Hi, it's Dawn from Dawning Path Wellness and Education with an ABC practice for pain management. So we can say, I can listen to my body and respond with care. And we tend to not do that. We tend to be like, oh, my hip aches, and then we just ignore that ache or pain. And we want to really normalize that pain happens, aches and pains occur, and they're not a failure. And it's an opportunity to simply listen and adjust. So, first A is for aware. Start to just simply settle into wherever you're sitting or standing, and just notice the sensations in your feet. Perhaps squeeze your feet. Take a deep breath in. Exhale, release, and notice. And then squeeze your legs, the glutes, all the way down to the toes. Squeeze it really tight. Take a deep breath in. Exhale, release the legs, the feet, the toes, and notice whatever is there. We're not judging. We're not trying to fix anything. We're simply scanning. Scan, squeeze, and release. Go ahead and pull in on the belly, the shoulders, even tuck the shoulders way up high. Squeeze the arms, squeeze the fists. Take a deep breath in. Exhale and let it all go and notice the sensations. Add on the face. Feel free to squeeze like you just ate a sour head candy and just really tighten the jaw, the lips, the nose. Squeeze the eyeballs. Take a deep breath in. Exhale and release, and notice the sensations in the jaw, the face, the eyes, the head. Perhaps you want to do the whole entire body, one full body, full squeeze. Take a deep breath in and then release it all. Feel yourself grounding and centering back into the earth or whatever you're sitting on, and notice the sensations. And perhaps now let the mind just simply wander, looking for areas in the body you might notice some body cues or messages of aches, pains, tightness. And we'll move into B for breathe. This strategy is called breathe and release. Take the area of pain you notice and simply breathe into that space. And I know you can't really breathe into it. We only breathe into our lungs. But imagine breathing into, so like for example, maybe it's a shoulder. Imagine breathing into that ache. And on the exhale, imagine it slowly releasing, melting away any tension, pain, or ache. And stay with that. Continue to breathe into the space and then release. The power of your breath and the mindset are incredible inner resources to navigate pain and ache. Now finally, C as a choice. If after becoming aware and breathing into it, you're still thinking, I need a little bit more for my aches and pains, we're going to move into what's called pendulation. And so go ahead. If it helps to close the eyes, feel free to do so and bring your awareness back to that ache or pain, or a different one if you've got more than one. Notice the sensations of the ache and the pain, or discomfort, tightness. And now let that go and let your mind wander and find a place in the body where you feel ease. Even if it's just the tips of your pinky finger or your earlobe, find a spot that feels completely, totally comfortable. Notice how that feels. And go back to the place of discomfort. And now toggle back to the place of ease. And continue to go back and forth at your own pace, sensing into the ache, the pain, the discomfort, and into the ease and comfort. You might start to notice yourself speeding up as you toggle back and forth, and maybe not. And eventually see if you can hold your awareness of both the ache and the ease, or the discomfort and the ease. Knowing that Life isn't this or that, it's this and that. We can hold space for both. And when you do this pendulation practice, it can often help to create a new neural pathway that helps you navigate and tolerate discomfort. So A, become aware. Do a body scan, squeeze, release. Do the breath practice of breathe into the discomfort and release. And then do some pendulation, rotating your awareness from the discomfort to the comfort. And hopefully after you've done this practice, you'll feel a little bit more steady, stable, and a little less discomfort. I wish you well.